Hello and welcome back to my YouTube channel, Dr. Magnesium, with myself, Dr. Lee Keegan. And this is just a quick 2-minute video to explain the pathophysiological process of cardiovascular disease and the relevance of UPF to this process. So firstly, just an overview of the heart. So the heart is essentially a large pump with 4 chambers, 2 small chambers at the top called the atria and 2 larger chambers at the bottom called the ventricles. You have the right ventricle and the left ventricle. The right ventricle pumps blood to the lungs to become oxygenated, which is then received in the left atria, passes into the left ventricle and is pumped out to provide oxygen and nutrients to the rest of the body's tissue and organs. Just as this blood is being pumped out the left side, it exits. There's a couple of little exits, or a few little exits, which are called the coronary arteries. And as the blood is squeezed out of the heart, blood shoots into these blood vessels, and it's these vessels that supply the heart muscle itself with oxygen and the nutrients within the blood. Over time, the inside layer, which is paving slab-like in structure, the long rectile thin cells which form the inner layer, smooth cells which form the inner layer of the blood vessels, coronary arteries. Over time, they can become irritated by things such as UPFs. An imbalance of oils such as omega-3 versus omega-6 can cause an inflammation of these vessels. The rough molecules within the blood from high blood sugars caused by metabolic syndrome and the likes, and the pro-inflammatory nature of eating UPFs themselves, the chemicals within the toxins within the foods, cause an inflammation of the inner layer of the coronary arteries. This layer becomes swollen, and the cells become pulled apart. As they become pulled apart, it leaves gaps, and through these gaps you get fat seeps in. So fat within the blood itself, again from eating UPFs, foods high in fat, you have a lot of fat within the blood. The fat seeps into the coronary arteries, or is pumped into the coronary arteries, seeps through the gap in the inner layer. It then settles between the layers, the inside layer and the middle layer, where it is detected by the body's immune system. Macrophages go to the site, they ingest or eat this fat and are killed in the process. They then become foam cells, and over time they become calcified and become atherosclerotic plaques, which just basically means calcium or calcified plaques. These plaques then squeeze their way in over time into the space of the coronary arteries, making them narrower. The pressure then from the normal part of the coronary artery to the thin part of the coronary artery causes the narrowing of the lumen, or the inside of the vessel, causes an increase in pressure. The conditions that make this worse is high blood pressure, obviously, which again we've established can be a result of metabolic syndrome from eating UPFs, as we explained in the earlier video. So the pressure build-up then behind the plaques causes a rupture of the plaque. As the plaque ruptures, it seeps out tissue fluids, which the body detects and thinks that you're bleeding out. So in order to stop hemorrhaging or bleeding to death, the body has the same response whether you cut your skin or whether it's a blood vessel which is damaged inside. It sends a platelet plug to plug off the gap, to plug off the source of bleeding, and sends then some clotting factors and proteins which form a clot. This then blocks off the coronary artery, which stops the downflow of blood, or blood down blockage. Flow of blood down blockage is reduced, which means that the tissue, the muscle, after this blockage becomes starved of oxygen, starts to die and break down. And this is commonly known as a heart attack, or within my field we call it myocardial infarction. And this is the process of how ultra-processed foods cause the conditions that lead to a heart attack. I hope you found this useful. If you need me to explain it in any clearer terms, or you want me to go into more depth, then just drop me a comment and I'm more than happy to do that. I will explain other conditions as well relevant to UPF in later shorter videos. Okay, a little bit longer than I wanted. I want to try and get it under 2 minutes, but I'm on 5 minutes. But thank you for listening. And again, if you're enjoying these videos, please feel free to like them, to share them, to subscribe to my channel in order to get the message out there. Okay, thank you for watching and goodbye.